Like the caliber of people that are drawn to functional medicine, to me, over 20 years has been just mind-blowing. So it's remarkable. I don't know if you have been following the thread on the app, but I mentioned to all of you on the first day that there is a separate Facebook page that's available for all of us and our peers to communicate. There's 3.6 out. There's 3,600 people on that site. And just realize that site was started by one sleep med neurology peds doc who was sitting in this particular room like 4 years ago. He said, wouldn't it be great if we could all talk to each other and share cases? It is awesome. And I mean, as a learning resource, to be able to go in there and search the archives, like our peers have been adding tools and resources and handouts into that subsection. So, I mean, it is like this cornucopia experience, and it is a major time suck. So be prepared. But it would be one of those places you want to touch base on it. So if you didn't hear me talking about it or the name the first day, go into the thread. I posted a picture of what that site looks like because, as you would expect, there's been a few attempts to model that on Facebook groups, and they're not the same one. Okay, so make sure that you check those words and you get those words right. So this is our opportunity to come back to the tools. We're going to take a deeper dive into the practical resources that you have access to. So when we talk about learning the science first, and then taking that science and then figuring out how to translate that into practical applications in the clinic, I think at this point, you're probably already going through that experience, right? Like, wow, okay, I've learned the science or I know more, but how am I going to do this? Right? How am I going to make this happen? Okay, this is the beginning of that lifelong learning process, right? It starts with the science. It starts with the knowledge. Get in there and just start experiencing functional medicine with your patients. And you've heard it from many of the faculty this week. You don't have to know it all before you can start. And if you don't feel like you know everything about nutrition, that's okay. Start where you're comfortable. So in this session, we're going to take some time to go through the tools. I want to make sure you know how to find them. I'm going to have a heavy emphasis today on where do you find all those nutrition tools and resources. Okay? And I've been studying under Dr. Stone for about 10 years, and I still don't know everything he knows. And I'm trained as a naturopathic physician where part of my specialty is nutrition. Okay, Dr. Stone embodies an individual who is like a part of this 4-generation nutrition family. It is not even a joke. When you marry one of the Stone children, you get your nutrigenomic panels done before you reproduce in that family. Like, I'm not kidding. It should not surprise you. You sit down in their bathroom and you should see the reading material, The Secret Life of Plants, right? And like, it's pretty amazing. So I don't want you to think that at this point in any way should you have mastered and memorized all the science and the details. Okay? For those of you who are going to opt to go on and move through certification, you're going to find that each and every dive deep down into those sections around the matrix is going to come back and tether to this home base, right? Think of IFMCP as though it's almost like like the hub of the wheel, right? And then all of your advanced practice modules and all of the additional learning, they're spokes, right? And you're going to continue to fill that out and start where you're interested. Start with where your passion lies, right? If you love working with women's healthcare, then think about going to the hormone module first, right? Or if you deal with injuries, recovery, pain, go to the energy module first. Take those next steps and think about what is most important where you are going to get the most out of that content and really love what you do. So in our conversation today, I'm going to give you this kind of high-level review and remind you that in functional nutrition and all of the tools, we've got some subcomponents in all of our nutrition resources that stem back to really our master operating system. There's an entire specific operating system designed to implement the functional nutrition tools. Okay, and you've gotten kind of a highlight of those this week. Okay, you haven't gone down into the depths, correct? So gathering skills, organizing skills, and initiation skills of how do I get started with nutrition. So one of the first things I want us to think about, and this session, honestly, I'm flipping it on you once again, and I'm going to put myself in the same space. Like, what if we're the patient? Doctor, heal thyself. Right? Self-care. On the first day I asked you, throughout the course of this week, think about the things that resonate and really strike you. So that when you leave here and head back into the life that you are living, what are the things that you're going to do different for yourself? Right? Because if you are not walking the talk, your patients are going to smell it. Right? Like it just doesn't work to tell people to do things you're not doing. So I'm going to ask you to go back into your folder, and if you would, there is a functional nutrition prescription and lifestyle plan. So this is a blank summary tool that we use all the time in functional medicine as almost like a contract or a state of agreement with the patient, that these are the things that we are agreeing you're going to work on between now and the next visit. Okay, right now, your name should go where it says patient name. Okay, accountability, self-accountability, congruency, authenticity. That's what this medicine is all about. Okay, so as we go through this whirlwind tour, I'm going to give you truly this highlight and remind you of the things that you learned this week. I want you to take your moments and work your way down this list. And between now and the time you move through Dr. Luby's discussion and Dr. Jones, can you commit to yourself that between now and the end of the day, you have this plan detailing for yourselves what it is that you're committed to doing? So I want us to start with thinking about the collaborative care team. Do each and every one of you feel right now that you know it all and you're going to be able to help every patient that walks in the door with all of their needs? Like very few of us do. Right? This is the beginning of thinking, how am I going to do this? And part of that is, who might I have on board that can help me? Right? Because often it's a time management aspect if you are a GP in primary care. Right? If you are in primary care, it's a time issue. Who's going to help you? And looking at your flow. So I want you to be thinking about who currently is on your collaborating care team. Who do you have to work with? You solo practice doc? Do you have any assistants? Do you have an MA? Do you have a nurse? Do you have any nutrition professionals? Do you have coaches that you have access to? And I want you to be thinking about your team. So on the back of this document, the back of your plan, maybe you can just even start to sketch out and list out, well, who are the people that you have on your team, right? And often in a collaborative care team model, we're going to put the patient in the center of the care, right? And there's going to be people maybe within the brick and mortar of your office that you're going to rely on first. But there's often people outside of that circle that you want to build as part of your referral team. I mean, one of the most frustrating things I hear functional medicine doctors say is they will get their patients motivated and excited to start exercising, and they'll send them to the local gym, and one of the local personal trainers will pick them up as their client and then transition and change their diet. Has this ever happened to you? I'm just using a simple example that actually happens often. Right? If you're going to work with somebody in the fitness world, you want them to understand what you do. You want them to know why are they coming with this particular plan, or how can you collaborate and work together. Right? So when you're thinking about how do we partner and with who do we partner, I want you just to take a moment and I want you to sketch out on the back of that document, if you would, put yourself in that circle and list out who are the names of the people you have on your team right now that can help you implement functional medicine. Okay, and if you are the only name that goes on the back of that page, this is your opportunity to dream, honestly. This is your opportunity to think about, okay, 6 months, 1 year, 5 years down the road. Like, what do you envision that team looks like? Okay. I see some of you did not bring your folders back to class today. So how do we act in that space of being a role model? How can our behaviors be this accelerant? How can we model this medicine in a way that we exist and inspire our patients? All right, I'm going to say it again. Doctor, dosaire. Our responsibility is to teach, to inform, and to inspire. And one of the most impactful ways we can inspire our patients and our staff is to be living in that space of authenticity and being real with ourselves, being real with what we're good at, acknowledging our strengths, and being okay with our weaknesses. So, practitioners, what we're doing matters. So, how do we facilitate goal setting? Because if you haven't noticed throughout the course of this week, this is all transformation medicine, right? You're taking the science and you're translating it into clinical applications, and you have to help your patients figure out how can they do this? How are they going to transform and make those changes happen? And lifestyle changes are not easy. They're not easy at all, especially if it's a habit or something you've been doing for the course of your entire life, right? Or there's entanglements behind the why are you doing it that way? Or if you're looped into patterns, or you're dealing with a jacked neurochemistry system, right? So how are they going to make some of those changes happen? How you frame things, or therapeutic connection, your rapport, all of those things are going to make a difference. All of those are going to make a difference. So we want to make sure that our patients are mindfully thinking about their goals and realistic timelines. Realistic timelines. It doesn't happen overnight. You're changing your lifestyle. It's not like giving somebody a pill and they come in 2 weeks later and they feel radically different. But if somebody is taking an anti-inflammatory, they may get immediate relief that day. How long is it going to take for the fish oil to be kicking in? Or that curcumin to kick in, right? Because we're looking at more of a systemic upstream approach, right? So we need to be realistic with our patients about their goals and their timeline, which is why you've heard many of the practitioners here say, start with where you are, start with where the patient's at, and start to make some slow changes over time. It doesn't need to be radical, right? You don't have to take the Dr. Joel Evans approach, which we still to this day, we laugh because we all have done it. We all come back super excited, really inspired, and we drop all this stuff on our staff, and we drop all this new stuff on our patients, and we think just because we know what to do and then knowledge has arrived, we just have to write it down and tell them what to do. You know? And it just doesn't work that way. It would be great. It's like parenting. Right? It doesn't work that way. So goal setting. Okay? Helping our patients get clear with their goals. So one of the things we talked about the first day is this illness-wellness continuum. Right? And how can we move our patients from this state of dysfunction towards the state of optimal health? Well, use your tools. Use the tools you have access to. So a wonderful teaching tool that you can use with your patients is called the Self-Care Questionnaire. It's literally one of my favorite out of all the 400 pieces of paper in that toolkit. This is one of the most motivating and powerful tools I love to work with. Not only one-on-one with patients, but this is a great tool to use in workshops, right? If you're running groups or you're teaching a local class, because this reflects and mirrors what is on the base of the base of the matrix. Okay, so what this tool allows for you and your patient to do is go down this list and say, all right, where am I doing a great job taking care of myself, and where are there gaps? Like, where are there spaces or places that I could do better? And then what I love about this tool is I'll pull this back out again a couple months later, and I'm going to go back to this with the patient and say, okay, let's look and see. These were goals that you had. How you doing? Where are we successful? Where might we still be struggling? And then you know what? There is a new round of new goals, right? And we have to continuously refocus on, well, what are the new goals? And how are we going to refocus? So use this tool to your advantage. It's powerful. It's simple. It can be used for a baseline and, again, for tracking. So then as the patient starts to shift, they're feeling different, their wellness is starting to transform, they're feeling better, then you can go back to and you can look at some of the ways in which this check and balance system can reinforce the positives. Right? So one of the tools that you were exposed to this week with Monique class was looking at these goal-setting resources. How many of you in this room right now have experience and you've been trained in a coaching approach? How many of you use a coach approach? Okay, then you would already be familiar with SMART goals, right, or utilizing SMART goals. So one of the nice tools that's available for you in the toolkit is a SMART goals list. And often, maybe it's the nutrition professional or the MA or the nurse or the health coach in the office. In addition to the practitioner, they may sit down and actually carve out what these goals are and identify what is it that we're hoping to accomplish between this visit and the next time we check in. So use these tools to get clear. Use these tools so that you have no question about what it is that you and the patient are going to be focusing on. And especially if you have multiple people on the team, you want to be able to make sure everybody that's talking to and touching that patient's experience is clear with what the goals are and the steps to get there. Okay. So on the way to this creation, we do know that patients are always going to find stumbling moments. It's just the reality of it. We all do as well. So if you could think for a moment about the bottom of your matrix, you could think about your lifestyle. Earlier in this week, I had you do the stand up, sit down, right? Stand up, right? So every time you stood up saying, you know, I could do a better job with my nutrition. I could do a better job with my exercise program. You know, I could do a little bit better with the foods I'm eating. I could be transforming stress more effectively and less painfully. You know, if all of those things rung true for you over the course of this week, then those are the types of things you should be putting down on your plan and your commitment to self today. Right? So the tools that we have to work with are there to encourage this connection point, to encourage and allow for this therapeutic empowerment to take place. Right? Because we're shifting the locus of control from the doctor's prescribing pen, right, to the patient, so that when they walk out the door, they're willing to look at and even consider adjusting some of those more detrimental behaviors. And so when we're looking at nutrition and lifestyle coaching, we train in the Functional Medicine Coaching Academy, we train all those coaches so they know what's the timeline, what's the matrix. Are the coaches trained and qualified to be making a medical diagnosis or a therapeutic recommendation? No, not at all. They're coaches. They're coaches who specialize in behavior modification. Tips and tools and resources to help our patients meet their goals. And if you have a coach that you're working with, they also have the responsibility of being able to understand what you, the prescribing practitioner, are looking for. So to have a coach that knows how to look at a timeline is wonderful. To have a coach that knows how to look at somebody's matrix and where to go from there is wonderful. To have someone on your collaborative care team that can understand the powerful way in which these lifestyle factors push their way into the rest of the clinical imbalances is key. So I'm going to share with you some of the tools you have for educating your patients, regardless of your degree, regardless of what your team looks like. You have beautiful handouts that all of you can use literally right away with your patients. Assessment tools, questionnaires, and education resources. So note that there is a large subsection of resources that's available to look at sleep challenges and sleep abnormalities. You just know this is an area of passion that many of our faculty have had and was a significant area of interest a few years ago. And so there is quite a large body of sleep-related resources that you'll see within the toolkit and some of the additional continuing education opportunities. Also know that those categories were broken into different subdivisions. And so, like I mentioned, you're going to have questionnaires, you're going to have journaling opportunities, and you're going to have resources where you can give the patient some suggestions and use these as talking tools in the office. Don't reinvent the wheel. And I'd say one of the very time-consuming but well worth it things to do when you come out of this program is to go back to the office and either delegate or create time and space for you to do this. But go into the toolkit and at some point print off the table of contents. I literally have the table of contents in my bag because when I got on the plane on Monday, my office manager said, hey, we're going to be launching this new detox next month. Can you go through the toolkit and can you flag for me all the handouts you want to make sure that I have available in the different weeks of the program? And like she just tasked me coming back with what tools am I going to use. Okay, so keep an updated copy of what that table of contents looks like so you can draw from it. And of course, you can always, obviously, go back to the digital version. IFM has done a brilliant job in continuing to update those resources. You'll notice at the bottom of every one of the tools, there's going to be a date and a version, right? Because they are continuing to update and bring in new science, new information, and adjust those so that they're in the current state. So print out the table of contents. And if you have enough ink in your printer and time, it's fantastic to print the whole toolkit so you can see it. I mean, how many of you feel like you can learn by flipping page after page after page or file after file after file through digis, right? It can be hard. So have somebody in your office make a big book. The big book that sits in the front of my office so I can go out and I can kind of flip through real quick and say, you know, I want that one questionnaire. And I was in charge of helping them make these questionnaires. And I don't even have them all memorized. There's so many of them. You know, come on, say, I want that handout. I know we made that like 5 years ago. And she'll be like, go look in the book. And so then I can see it, I can quick find it, and then she'll go and she'll download it and make sure we've got the most current copy, or she'll email them to my patients. And so it's a wonderful way to communicate with your patients in your follow-up visits. So there's also a whole suite of resources and tools that are in there that relate back to exercise, movement, and fitness. So do know that you have got goal sheets, you've got tracking journals, you've got questionnaires, you've got a whole host of resources that you can draw from. Okay? And as you heard throughout the course of the week, exercise as medicine. Right? And there's some wonderful resources out there for training physicians to implement exercise as medicine. If you look at Harvard's lifestyle training programs, they are teaching physicians how to prescribe exercise. Okay, so there's resources for us to use and integrate. So you will see them diving into some more of those additional details and what's most appropriate to customize or create the program for the patient. Now, if you have never been involved in a vigorous or specific personalized training program, if you don't have a background or history in this level of education, how comfortable might you feel prescribing? And is this your area of expertise? Right? Hence, one of the important people on your team is often someone who's either in exercise physiology, exercise rehab, somebody that's a trainer that you want to think about and bring into your practice. So as you're looking at who's on my team, we know that we need to get our patients moving. We know that we often want to bring them through levels of just movement and on into higher levels of fitness and expertise. Okay, next, I want you to know there's a segregation, there's a differentiation in the toolkit items. In regards to this category, there's a set of those tools designed for fitness and performance, and there's a set of tools and resources that are designed and dedicated to movement. Right? And so even the patient that comes in with a MSQ score of 140, severe pain, may have a BMI coming in at 40, who doesn't feel very inspired or ready to get started on an exercise program, you may want to step back and look at some of these tools that can help them get moving. Right? Because we know that sedentary living and sedentary behaviors, they are sedentary movements, sedentary behaviors, it's the new smoking. Sitting's the new smoking. Congratulations, we did a really good job moving you this week, didn't we? Don't forget, yoga's at lunch today. Did you see that on the schedule? All right. So in these tools, you can also use some of these tools for tracking your patients who might be dealing with challenges that may come back to either litigation, or you may be doing various different tracking for medical cases. And so know that we've got daily activity questionnaires. There's a whole host of tools and resources so you can document disabilities and changes or transitions over time where the patient is more capable of making some of those life adjustments on a day-to-day basis. Okay, there's also a whole suite that marries movement, exercise, and mindfulness. Okay, so know that there's sort of these combination documents that both inspire and educate the patients. So we also use this term restoration. Right? Restoration is our ability to reset, to calm, to come into that center point. And so we have a whole suite that is available. We did some of these exercises this week ourselves. And sometimes they're easy to get into and participate in, and sometimes they can be more challenging. Yesterday morning, remember when Dr. Keisha was taking all of us through the stress lecture, the adrenal lecture yesterday? Okay, and it seemed like such a simple exercise, right? Let's close our eyes and go to your happy place. Okay, like the day before, I had no problem going to my happy place. I was like right there. I was sitting on top of Mount Hood. The sun was baking on me. I was breathing all that cold, crisp air. And I was thinking, yeah, my cold therapy is burning my fat right now, right? Like that's my happy place, right? So yesterday, should be simple. She asked me to go to my happy place. Sit in the back row in the corner, close my eyes. I actually can't find my happy place. I can't even go to my happy place, and I was just in my happy place the day before. And then the next exercise. Can you go into the space where you feel uncomfortable, right, or where you feel off-center? And like, I couldn't breathe. I'm sitting in the back corner, I can't breathe, and I just start to sob. And this beautiful doctor sitting next to me looks at me and she says, "Can I take you out and get a cup of coffee?" Wow, right? Like, incredible things happen, right? Moments of insight, right? We walk out the door. I haven't said a word, And the words that come out of her mouth are exactly connected to the pain I'm feeling in my heart. Her intuition and insight, it was divine. So we go and have a cup of coffee, and I cry so hard I got snot poured on my face. Have you had that happen? And I'm like, when is the last time I had a deep cry like this? Like, I can't remember the time I cried from my guts. And I'm in this space and I'm in this place, and my little brother committed suicide a few years ago, my only sibling. And I lost my little brother. And I am sobbing and grieving at this level that I don't have any idea where it came from in this depth. And then you know what happens. One of my mentors and guides, Dr. Stone, walks up to me. He says, "Can we talk?" That would be a good idea. Okay, so he gets me so I'm not heaving anymore. We come up. Next divine soul I run into is Dr. Joel Evans, and he says, Can you just stand with me right here? Be present and let me take you through a guided imagery. On the spot, right outside that door. And he took me through layer after layer after layer after layer after layer after layer, and then, boom, I got the insight. He literally peeled it back for me and walked me down this corridor, and then there was my answer. It was so powerful. And then Dr. David Jones came around the corner and said, "Can I talk to you?" Which then I went on to transform into being joyful and happy and sharing the process. And this all happened, and it got sparked by me doing that HPA lecture yesterday. Remember when Monique is talking about the difference between change and transformation? I feel like yesterday morning I went through a year's worth of therapy. And I know all these things. My peers stepped in at exactly the right moment, integrating their insight, their perception. They asked me open-ended questions, and they just loved me through my healing crisis that I was going through yesterday morning. And I woke up this morning, and I literally feel like I'm 1,000 pounds lighter. I think I might even be brighter today. And so these tools are in here for a reason. I cannot encourage you enough to walk this talk. Because healing requires a lot of bravery, doesn't it? It requires this connection to self, right? It's authenticity. So, I'm talking about pages, piece of paper you can print out in the toolkit and give to your patients. But it's just modeling and reflecting, right? It's just reflecting. The beginning of implementing a resource, and it's a talking tool to get started. The handout is not going to do that. If Joel Evans gave me a handout and said, "Here, why don't you take yourself through this guided imagery process? Call me next week, Christy. Good luck with that." Okay, do you understand what I'm saying? So use the toolkit appropriately. Educate, inspire, plant seeds. Right? And Michael Stone didn't have the same skills of directing guided imagery that Joel Evans did because they have different strengths and weaknesses. Right? And then turns out that Michael Stone recruited David Jones because he knew David Jones needed to be on my care team yesterday. You hear what I'm saying when I'm talking about a true collaborative care team? So create that team. Think about who are those people and those resources for your own medicine, for your own healing response, and for your patients who are in need. So you have beautiful tools and resources that the mind-body team, often led and championed by both David Jones, Patrick Hanaway, and the influential factors of you met this week, Monique Class, Joel Evans, our Dr. Beth Frades from Harvard. We have some powerful practitioners and physicians who helped us get this far in their areas of expertise. Okay, so I want to shine the light on that in these 4 areas: exercise, movement, sleep, and restoration. Okay, in those 4 areas, you also have some tools that were designed to give you information. These are not patient handouts. These are resources that are filled with ideas about, maybe apps your patients might use, or devices that you might rely on, or books that you might recommend to your patients. So these tools, they're called, again, appropriately, the resources and referral documents, come back to all the work that was put on the stage that year when these subject matters were brought forward. Okay, so going back to your collaborative care team. And when you go back to the collaborative care team model, you also want to make sure that the roles are clear. If we're going to have a nutrition professional, or we're going to have an MA, or we're going to have a coach, or we're going to have a nurse, someone involved in the care, we want to make sure that they also understand how do they use these tools. Okay, they're not often filling out the medical components of your matrix. They need to know how to look at your matrix, add to your matrix, or bring back to your case consultation ideas or insights that they gathered in working in space with that patient. Okay, they're not doing your functional medicine, they're supporting the functional medicine process. Right? So we want to be clear with how we train our collaborative care team to be involved. And can each of you just take a minute and talk about who's on your current collaborative care team and who would you like to see involved if you can put yourselves out 3 to 5 years in the future?